All right, y'all. Welcome to the Unfazed, Unedited podcast, where we provide commentary on complicated topics in an uncomplicated format. I'm Dr. Shauna Payne Gold, and I go by she, her, hers pronouns. And Dr. Lisa, we're gonna have a little fun with a serious miscommunication here. We're gonna have a little fun today, but how are you doing?
I am doing a-okay, enjoying the sunshine, but not enjoying the political environment. So,
Oh, yes, another day, another
another
day.
day, another catastrophe.
What is it? The damage report? It's like the damage report every morning. It's like, oh, what's happened in the
Yeah, I
last
mean,
24-hour cycle?
it is. It's exactly, it's every,
Shh.
I get a text from my dad about something. I'm like, shit, that happened 7 days ago. There's been like six additional things. You're like
Oh, for
behind.
sure. For sure. I cannot keep up. Cannot keep up. So, with that, let's get into what's recently happened, which does touch home a bit for me, Lisa, and it might for you as well. But, you know, who hasn't taken acetaminophen at some point, right? So let's get into our word of the week. Word of the week is, let's say it all together, people, acetaminophen. All right? Acetaminophen.
Oh boy.
Now, we know this is usually for pain relief or, a fever reducer, but it's the active ingredient in actually a couple different things, Panadol, but also Tylenol, which has been in the news recently. Usually, what it's used for is to relieve your mild, moderate pain, whether it's, a headache, a muscle ache, backache. I know I've taken it for dental work for a toothache where I didn't want to
Hmm.
take something heavy, but I took that. For those of us who have menstrual cramps, sometimes it's used even, for example, Lisa, if you either already have the flu or if you're going to get a flu shot, a mild dosage of it so that you don't feel some side effects if there are any. All of that going on. All this to say with the disclaimer, Lisa, you and I, we're doctors, but we're not that type of doctor. Okay, so
Nope.
please
Nope.
let's put the disclaimer in that you will not get any medical advice on this podcast at all. But we have to address acetaminophen and how this word has been tossed around like an old rag for what the
Hmm.
last little bit of time here in the news.
Yeah.
Um, yeah, this is ridiculous, Lisa, how our word of the week has been misused, abused. I'm just waiting on whatever lawsuit might come about, depending on how much courage people have. But Lisa,
Hmm.
tell me about your experience with acetaminophen, whether you've taken it or not, and whether we should take this whole conversation seriously at this point. Because if you trip over saying acetaminophen, I'm going to have jokes. I'm going to laugh. I mean, I'm just letting you know now. I'm going to laugh.
Acetaminophen. Yeah. I just thought that was for those who
Practice,
didn't
practice.
see it,
Why
our
didn't he practice it, Lisa? Why didn't he
dear,
practice it
I don't know,
beforehand?
dear
Phonetic
leader,
spelling.
yeah, couldn't pronounce acetaminophen. Um,
Good grief.
so I mean, yeah, Tylenol and others. In the UK, it's called paracetamol.
Okay.
Um,
Mm-hmm.
but essentially same thing, right? Like exactly what you had said. It brings a fever down. It's given to people who don't want any kind
Mm.
of opioids or NSAIDs or other things that
Yeah.
feel too strong. So I don't
Mm-hmm.
know. This is a little bit of a tongue-in-cheek word of the week because we're gonna do a single phase this week, and we're gonna talk about
Mm-hmm.
all of the, as you would say, Shauna, foolishness around
Foolishness. Yes.
connecting Tylenol use in pregnancy and autism, and this will
Mm.
likely spiral into a conversation around vaccination.
Uh-huh.
Skepticism too, I would imagine. So let's go ahead and jump into phase one, our only phase for today. Okay, so
I
for
can't
those of
stop
you,
laughing.
I know. For those of you who don't recall, a few weeks ago, at the end of
Mm-hmm.
September, there was a press conference where the president and RFK Jr., who's the Secretary of Health and Human Services, announced this shocking breaking news
Breaking
that
news.
acetaminophen, but they only really, well, he only really used the Tylenol, the brand name of one drug,
Hmm.
is associated with autism. So pregnant people, mothers in particular was the term used. Do not take Tylenol while pregnant because you will, quote unquote, give your child autism. Um, and there's been some funny mashups, Shauna, of that press conference where they take the president's "don't use Tylenol" comment, which he said probably somewhere in the range of like 15 times
Oh my
in the course
gosh.
of the press conference, and like
Hmm.
a mashup of this. So I think we wanted to talk about this because there's a couple of different pieces. So there's the two
Hmm.
primary areas I'd like to focus on, Shauna, is how this um, misinformation or perhaps misrepresentation of the scientific um, fact
Yeah.
and what that does for our trust in the medical field, in particular
Yes.
for marginalized communities who already have low trust in medicine. But then also
Hmm.
the secondary piece is the ways in which women in particular were kind of both implicitly and explicitly blamed for if their child is autistic, it's therefore your fault because you took Tylenol. So I'm not sure
Hmm.
where you want to begin with just starting with those two kind of big takeaways from the press conference.
Well, bottom line, there is no definitive, none, not a stitch, not a bit
Right.
of definitive evidence that says that acetaminophen causes autism or is even connected to autism. What I found interesting, Lisa, is that a lot of physicians, including entire organizations, but I'm just thinking about individual physicians that are board certified, double board certified, that are usually not as vocal on their social media platforms, that are now
Mm-hmm.
using their platforms
Mm,
to work to dispel this completely false misinformation. And so I appreciate them coming forward, especially the ones that are Black and brown, the ones that
mm-hmm.
that obviously we know there has been a historical distrust of medicine, period, amongst those groups, those physicians coming forward to make statements around this topic. And so, with that, this uh, feigned link between
Yeah.
Tylenol and autism, or acetaminophen and autism specifically, this is widespread concern. We know what this is, though, Lisa. This is intentional confusion in many
Yeah.
ways because it continues to lead to this public distrust. um, it's an easy way to think about how, again, we've talked about this ad nauseum, so I'm not going to go too far down this street, but we have talked about how experts are disregarded. And so the
Right.
fact that you have major medical consensus that there is no connection should tell you something. So, American College of Obstetricians and Gynecologists, American Academy of Pediatrics, and the FDA all continue to recommend that it's safe for pain, for fever during pregnancy, so forth and so on. No. In fact, what it's meant to treat, if it's not taken, could be far riskier. So, if you happen to be a pregnant person, for example, and you don't take acetaminophen of some sort and you just have untreated fever, that is more
Right.
risky than
Right.
actually taking it. And so, medical professionals are trying to make it clear that avoiding taking this due to this scary boogeyman of what they've deemed as a connection to autism, you could end up being worse before you're better. And so that internally can harm the parent and the fetus if you don't take
Mm-hmm.
acetaminophen. And so, with that, you know, again, always trying to dispel these myths. I personally was deeply offended by the statement because I do have a child that's on the spectrum and I did not take any Tylenol while pregnant with him. and there still is no connection, and the medical community agrees with me. Or no, let me reverse that. They're the experts. I agree with them. And so
Yeah.
given that, I'm like, mm, that's not going to work. That's it's not going to work to leverage against proven medication and then think that you're not going to be held responsible for what could be the potential outcomes if people choose not to take it and then worse happens. That's my big fear. That's a really big fear of mine.
Yeah.
Um,
Yeah.
you know, these there's no science. Let me just put it there. Now I know we've got RFK and a president that pretty much, in my opinion, is anti-science. But for
Mm-hmm.
those of us who are under the sound of our voice and or reading this podcast, please know that we believe in science up in here, and the science makes no connection between the two. So you make your choice based on the science, knowing that again, this is another strategy to confuse. The confused mind does nothing. Every time there's confusing information, people just kind of sit still. We went through this in the middle of the pandemic. We went through a number of different things. I'm not picking up what they're putting down, Lisa. I'm just not.
Mm-hmm.
Even with a child on the spectrum, I'm not picking up what they're putting down at all.
Yeah, I mean, I think there's a couple of studies that showed that there might have been a weak association, but in one of those studies, then they pulled in some more like identity and kind of genetic variables, and the association went away. But an association is not causality. And actually, the FDA commissioner who was on the news saying that
Yeah.
this dean of the public health school at Harvard said that there was a causal link. He was not true. I guess the dean never said that. And the FDA guidance that went out to physicians in the wake of this announcement again underscored that there's been no proven causal link
Mm.
between acetaminophen use and
Mm-hmm.
autism. But that's not what they said in the press conference. And then I was watching a doctor that's like you said, all these doctors have been coming out on socials to correct it.
Mm-hmm.
And she was talking about, she cited a study, something like 50% of people don't understand the scientific method, meaning
Yes.
you have a hypothesis, you test the hypothesis through like a rigorous study, and then you get a
Mm-hmm.
result, and then that result is replicated. It's a bit more in depth than that. But essentially, she's like, so a lot of people
Yeah.
don't even understand what that means. So when you
Mm-hmm.
say the science, the quote unquote science doesn't support a
Mm-hmm.
causal link, meaning A causes B.
Right.
They don't even understand how a doctor or a medical researcher could come to that
Mm-hmm.
conclusion. And so
Yeah.
because they don't understand it, they question its legitimacy, right? So then when you have
Mm-hmm.
RFK saying, and a
Mm-hmm.
president who you might support saying, don't do this, it's bad, it will cause autism, which is, like you said, factually untrue.
Mm-hmm.
Because they don't have that background, they don't know
Mm-hmm.
that what they're being told is wrong. So it's like doubly problematic because you had this like artificial end of September deadline that RFK chose to announce what the cause of autism is, right? Which you can't
Mm-hmm.
do from January to September. You can't do rigorous gold standard scientific studies in 9 months. I mean, these
That's
things
right.
they go for years, and you have to replicate the
Mm-hmm.
results. So
Mm-hmm.
they imposed this artificial deadline, and then they kind of grasped at some straws and some very flimsy research, and that's what they announced. And then on the other side of it, you have a general public that's just largely uneducated about the scientific method and how we
That's
can
right.
come to conclusions about whether or not something causes something.
Mm-hmm. Mm-hmm.
Um, so I
Absolutely.
I share your concern, because if you have folks who are already skeptical of medicine, and they may or may not go to the doctors, and they're making these choices around
Yes.
acetaminophen
Yes.
use, either
Yes.
with or without doctor's advice, then the consequences are going to be severe.
Well, and think about, I know this sounds so conspiracy theory-ish, but Lisa, we always at the bare minimum think about our social identity wheel. Which identities are the already the most at risk ostracized, historically abused, and excluded from medicine. Um, and we know what those groups are: women and or birthing parent caregivers, right?
Mm-hmm.
So that's one group.
Yeah. Yeah.
Then people of color who have been constantly abused
Mm-hmm.
historically by US medicine in this country. Um, then, add on to all of that, um, we can kind of go gender, we can kind of go with caregivers. Um, People of color and caregivers, excuse me, medical professionals of color who then have to overexert themselves once again, not only to
Right.
practice medicine, but to convince their own communities that they belong to that they can be trusted with the science.
Right.
Then add one more identity group on there. Remember, education is on that social identity wheel. Here we go, pretty much saying that your expertise doesn't matter. Like I think about it all the time with medical doctors that have to be board certified and all these other things they have to do through the medical profession. And every time some shit like this pops up, if I were standing in their shoes, it makes me feel like, well, shit, I don't have to stand in their shoes. Let's stand in our shoes. It's happened to us too, as DEI strategists and professionals.
Mm,
His language, behavior, and opinions attempt to devalue their life's work.
right.
I'm sorry, but you can't just wake up in the morning and say that acetaminophen is bad for pregnant people and their fetus just because you feel like it, and completely tear down people's entire life's work to, in fact, help people.
Right. Right.
I'm sorry, but I'm just not willing to let his opinion be the steering wheel of everything that I say and do. I'm just not.
Mm-hmm.
Now,
Mm-hmm.
when you're an expert and you have all these other things behind you where your peers who have equal, if not more expertise, have validated that you know what you're talking about, I'm listening to you before I'm listening to him. Tomorrow, it could be gummy bears, Lisa. Tomorrow, he could just wake up tomorrow and say, look, gummy bears will cure you of everything: flu, COVID, gummy bears. Just because he feels like it, just because it's on a whim. And they say we as women are moody. Bullshit.
Right.
I call bullshit on that. And so, with it, I think, what's going to need to continue to happen is that, of course, it may even be decades of medical professionals that are still going to have to continue to break up the misinformation, remind people of what their options are, remind people what the unsafe
Yeah.
option is, and allow them to make their decision. But to blame it on all these different demographics. Oh, and then the most, I would suggest the chief among all the equal identity groups, the autistic community, the
Mm-hmm.
neurodivergent community, that gets blamed for then being the problematic outcome of taking acetaminophen. Like, how many, it still feels like the bully that picks on the smallest kids in the class.
Right.
Every time he opens his mouth, it's like bullying the smallest kids in the class. Because he didn't pick it. He didn't mention that about any other demographics in the medical community or in the healthcare community. He didn't pick on those demographics. Didn't pick on those. Those were selected for a
Mm-hmm.
reason. So,
Yeah. Yeah, and the way all of them, RFK, the FDA person, McCary, I
mm-hmm,
think, talk about
mm-hmm,
autistic people as though it's like this illness or disease that you catch, right? And that it's difficult to
uh-huh,
be around autistic people, like they make you uncomfortable, so therefore we have to fix it for my comfort versus
mm-hmm,
the folks are just they're just there's just a spectrum of
mm-hmm,
there's a neurodiverse spectrum and we all sit somewhere on that spectrum and all are equally
mm-hmm.
quote unquote normal, acceptable, right? But our whole world has been oriented around
That's right.
neurotypicalness.
That's
And
right.
so then that creates this othering that happens. So it's just even, the science aside, it's just even kind of the disdain
Mm-hmm,
that kind of drips from
mm-hmm,
these quote unquote leaders I use that
Uh-huh.
term loosely, mouths
Yeah.
as they talk about autism and the ways that
Mm-hmm.
it affects families. And I know for some families who have children who are, I don't know if this is the right terminology, but like severely autistic or have like they're nonverbal and they really struggle. And there are a
Sure.
percentage of people that fall into that group. I know that it's really
Mm-hmm.
hard, and some of those folks felt heard by
Mm-hmm.
RFK, but that is certainly not everyone's experience, or indeed the majority experience. I don't think
That's
that's
right.
not to say we
Mm-hmm.
shouldn't support families and do more research, but it is a bullying, like you're different, right? We have to fix this. You have to fit in, and let's just also blame women for
Mm-hmm.
taking Tylenol, because really you should just,
Mm-hmm.
Shauna, when you were in pain in your pregnancy, you just needed to fight like hell,
Oh
right? You
yeah.
just need
Oh
to
yeah.
fight like hell not to take it, right? Because it's
Mm-hmm.
really bad. It's really bad because I feel like it's really bad, Shauna, that, you know, so
And what I just heard, in you facetiously saying that, what I just heard is, I feel like you need to keep suffering. That's what I heard.
right.
Just suffer. Just, even even on good days in pregnancy, it's not great. I mean, it's just not great. It wasn't great for me anyway. But even on the good days, it's not great. So what I hear is, oh, if I have something that can relieve one thing that's going on with me out of the 100 things that are going on with my body during pregnancy, don't take it, because
Yeah.
you should just suffer, just in case. Just suffer.
Yeah.
No,
All these men who have no idea what it means to be
none,
pregnant and how that feels
none.
like, and the stress on your body, and and as that,
Mm-hmm.
as you go further along in the 9 months, and
That's right.
it's just so obnoxious
Mm-hmm.
to
Oh yeah.
me. And and then the president who got out of serving in Vietnam, was it Vietnam, because of bone spurs?
Incredible. Incredible.
Like
Well,
I'm
but
like, oh dear God.
but let me go back to something, because I know this is your methodological brain here, and I know I'm going to fumble it, but I, I'm relatively clear on this. But let's get correlation and causation clear for folks that are not methodologically sound in this, like going
Hmm.
back to your scientific method point. For folks that don't get correlation and causation, just because two things are there doesn't mean that one affects the other.
Right.
And I think that's what unfortunately gets conflated. And obviously, y'all's president completely made it causation, like 100% causation, when it may be neither. And so with that, I'm like, this is the frustrating piece. And we see it happen in milder things, Lisa, where people think, well, just because two things are there, that doesn't mean that one caused the other. They just happen to be there, right? We talked
Yeah.
about this with certain cities that have been talking about their crime has been going down. And then there was also talk about other things that were occurring. There may be causality, but depending on how the methods were set
Hmm.
up to determine, it may simply be correlation. Those two
Yeah.
things may have just been happening at the same time. So crime may have gone down at the same time that a community center opened, but we don't know if the community
Right.
center drove crime down. Am I
Yeah.
on it?
That's, yeah, 100%.
Okay, and so with that, that's where the problem lies, is that most folks don't understand the difference between those two. Well, the the birthing parent had Tylenol, and the birthing parent happened to have a kid on the spectrum. So I'm just going to assume that one caused the other.
Right.
When, if you're like me, didn't have any Tylenol during the pregnancy, still had a kid on the spectrum.
Hmm.
Like that's where, again, I'm like, can we stop blaming parents for
Yep.
everything? Can we think more deeply? I want to applaud those in the medical community, those that have spoken up, from autism centers. The center where Trey was tested on the spectrum has come out with a lovely statement in regard to the lack of causation between the two. I'm so appreciative, because they're having to work harder to help guide people through an already misunderstood experience in this country.
Hmm.
It's already overwhelmingly misunderstood what the autism community is like. I mean, one of the things that we've been working on, in particular is connecting all the people that are extraordinarily gifted that are on the spectrum in particular areas. So overwhelmingly, artists of color are on the spectrum. Overwhelmingly, inventors of color are on the spectrum. All these people
Mm-hmm.
that have made major contributions to society are on the spectrum. So to hear someone talk about, oh, it's bad, and we pretty much need to fix the
Yeah.
autism community just
Yeah.
burns me up because I'm like, that's just not the reality of the lived experience of the autism community. It's not. So if
Yeah.
we get rid of all the people that have autism, let's get rid of everything that you have. So let's get rid of art. Let's get rid of major technological inventions. There's a laundry list of things that would go away if you tried to get rid of the autism community, things that all of us use every single day.
Yeah, but those things aren't really valued by the current administration, I would argue. Um,
Yeah, that's true, especially when
yeah.
it comes to art, of course. Yeah, yeah,
There's
yeah.
a really good meme that's going around. I saw it years ago, but it's kind of resurfaced, and it's a cat, a
Mm-hmm.
little cat that's sitting on the top of a um in apartment complexes where there aren't garages,
Mm-hmm.
but there's like covered parking, and you have the big roof of the covered parking, and then there's like pillars and the cars parked between it.
Mm-hmm.
There's a picture of that, but it's dented. The roof is dented, and in the dent,
Uh-huh.
there's a little cat sitting on it,
Uh-huh.
and it says underneath, correlation is not causation, right?
Yes, yes.
Like
I love
the
it.
cat being there doesn't mean the cat created the roof collapse.
Hello. Hello. Exactly.
Um,
Exactly.
yeah,
Can I tell
yeah.
you, so can I tell you a funny? I found it. I was looking for the list that Trey and I were going through the other day around people, notable people that are in the autism community. You're gonna love this.
Okay, great.
Hold on, put your seatbelt on, put a helmet on, possibly for this list.
Okay.
So we have definitely a bunch of scientists. So Albert Einstein, Charles Darwin, Michelangelo, Isaac Newton, Andy Warhol,
Mm,
Emily Dickinson, Thomas Jefferson. All right, that's a few. These are the ones that you're gonna love. Temple Grandin,
mm-hmm.
Bill Gates,
Mm-hmm.
Elon Musk,
Oh, that, yeah, I'm not surprised by that.
Nikola Tesla,
Mm-hmm.
um, Denai Guerrera, who played in Black Panther, she was the general in the Dora Milaje in the movie. There's a laundry list of people that are part of the AS community, ASD community, depending on how you define it. Come on, man. Like this is not a quote unquote problem to be solved. It's just not.
No, no. And the other thing that, RFK says especially is that we have a huge epidemic because the number of children, especially that are being diagnosed with autism, has like shot up exponentially. Like I don't know what the percentages are, but it's massive now, right?
Mm-hmm.
But what he's
Mm-hmm.
also, so to him, that tells him that there's some kind of environmental something, whether it be Tylenol or vaccines, right, that are causing this rise versus diagnostic criteria has changed over time. So as we broaden the diagnostic criteria, unsurprisingly, more people are then covered by that criteria and get
Exactly.
a diagnosis.
Exactly.
And so, and
Mm-hmm.
then,
Mm-hmm.
so that has grown, and we didn't even know what autism was X number of years ago. So, like, no one was getting diagnosed with it, right? But that doesn't
Right.
mean, to your point, like Albert Einstein, Thomas Jefferson, like, doesn't mean that
Right.
these people were not autistic. We just didn't know
Mm-hmm.
what it exists. The same way that pancreatic cancer has always existed, most likely. Actually, I don't know
Mm-hmm.
that. I'm presuming that.
Mm-hmm.
Um,
But there are some medical conditions that have existed well before they had a name.
Exactly. And now what? So now suddenly more people are being diagnosed with it, which might be true in some cancer
Mm-hmm.
scenarios. I don't know, but like that doesn't mean it didn't previously exist, and it doesn't mean it's a
Mm-hmm.
new environmental something that's caused it, right? And
Mm-hmm.
but that's how scientific knowledge is, right? You test and you discover, and then you retest and you discover, and that's how things move forward, and that's how we end up with cures for shit. That's how we end up under like diagnosing or understanding these rare diseases, right? Is because of that whole process. But we've also
Scientific process.
also slashed all the funding in many cases to
Mm-hmm.
understand all
Mm-hmm.
of these diseases better. And
Mm-hmm.
yeah, it's just so frustrating. And RFK is such a quack and not even a medical doctor. Not, I
Not
mean,
even
he's,
close.
it's just he believes that Tylenol causes autism. He believes that vaccines cause autism. And so that is the direction that he's going, which is also backwards. You don't start with a conclusion and then get data to match your conclusion. You start with a question, you explore and test, and you get an answer. Like, so,
Scientific
yeah,
method. Yep.
yeah.
Yep. Exactly. I mean, I would love, Lisa, to think that you and I eating chocolate bars and drinking coffee on the couch every day keeps us healthy, but we know that's not true. In fact, experts have told us that it's not
Yeah.
true. Common sense has told us it's not true. But if you and I believe it hard enough, it'll happen.
Right.
That's the administration we have right now. If I
Yeah. Well,
believe it
yeah,
and we convince the masses of it, then it'll happen.
it's not a fact-based administration.
Look, let me tell you something. Anybody that believes anything in regards to their health from two individuals who have, and I'm not saying this in a joking fashion, they're both of them, their health is questionable.
Hmm.
They have to govern themselves, and they clearly have not based on the status of their health. Would you trust that person to tell you how to manage your family, your unborn child?
Yeah, I mean,
I'm not
like,
trusting it. I'm not trusting it at all.
RFK has a lot of drug use in his past, and I think he had like a brain worm or something. I don't know. He's got had a lot of shit in his life that is all self. Oh, actually, I don't know how one gets a brain worm, but like the drug use is self-imposed to some degree, right? He's also very rich, comes from. I mean, there's a lot there. But that doesn't mean that he couldn't have become a medical doctor and been an educated person on these issues, right? Like that background doesn't necessarily disqualify him from providing medical advice if he has a medical degree. But he has this background that, a lot of like, I think, cocaine and heroin and a lot of drugs. I mean, I don't know what that does to your cognitive abilities over time. And you don't have a medical degree. So, I mean, I'm not educated enough to know the impacts on the brain around substance use, long-term substance use. I mean, I'm making an assumption there that it's probably not a good sign, but like, okay, but you don't even have a medical degree.
Not even close. Look, my I'm like, this man doesn't even have a band-aid in his pocket, and he's telling us what to do with our medical lives. No, no, I'm not picking up what they're putting down. I'm not. I'm just not. I'm not doing it. You are not qualified to speak to me about an unborn child. Just not.
Right. Yeah, and newsflash, women are not the cause of all the ills in the world. So I know
Oh, we're not?
you're trying to pin this on women too, right?
We're not.
Uh,
We're not the
no,
cause of everyone's travails in life. What? This is news to me.
I know, right? I know.
Good
Shocker.
grief.
Newsflash. But
Good
I don't know.
grief.
I guess the long and the short of us having this discussion is for folks to say, like, speak with your doctor, speak with a professional who
Absolutely.
has a medical degree and a medical license and doesn't have any ethics violations, right? And is that they're the people you need to be taking cues from related to acetaminophen use and anything else, vaccines. We haven't obviously gotten into vaccines in this podcast, but
Mm-hmm.
it's
Mm-hmm.
connected because of the RFK piece. But
Yeah.
don't
Yeah.
don't please don't take
No.
RFK and the president's word because their feelings about things are not they're not something
Scientific
that I think,
sound.
yeah, you should not be making life choices based on their feelings.
Mm-mm. Mm-mm. Absolutely not. I mean, right now, going to your point of vaccinations and whatnot, I literally just set my appointment for
Hmm.
this afternoon to go ahead and get my COVID and flu, which I've done in previous years where I got both of them at the same time and was fine. Well, under this administration, when I went in to make my appointment at my pharmacy, there was a list of things. If you are 65 and under, 64 and under, um, there's a list of things that you pretty much need to have as a health condition to qualify you in order to
Hmm.
get the COVID shot. But There's no mechanism for proving that you have it. Some of these things you just literally can't prove that you have. Some of it's none of your damn business. I mean, it is. I'm like, are you serious? Like, it was a drop down list, Lisa, where I had to scroll to
Yeah,
get through the list of, am I qualified to get? And so I reach out to, my medical professional to say, yeah, what is this all about? She said, just go get it. Whatever they ask you, you just nod and say yes and go get it. Because whether you have it or not, there's no, here we go with the big facade and no mechanism supporting it. They don't even have a process for you proving that you qualify for
right,
these vaccines to begin with. So if you're really caring and in the interest of the American people, you would at least have a system for this. You don't. So you've created a firewall that people need to get through, or they see the drop down list and they get scared and don't do it at all. And then we have
right.
more unvaccinated folks that probably wanted to get vaccinated but won't because they think they don't qualify.
Yeah, and this is what RFK said at his hearing, a month or so ago, where he's like, I'm not preventing people from getting the COVID-19 vaccine. It's totally available. Well, it's actually not totally available because you have to qualify through one of these things, and that itself might be a deterrent. And that affects whether insurance companies cover it. So if I want my family to get it, but we don't fit any of this random hickledy
There you go.
pickledy
That's
process
right.
or whatever, right? Then my insurance company is going to say, okay, $300 or whatever, and I don't have that. So
Exactly.
it's just not universally available anymore. It's just
Look,
bullshit.
so I'll give you a little funny and let you go. So there's a long list of things that qualify you for a COVID vaccine.
Okay.
So I'm still on the phone with my medical professional, and one of them is lack of physical activity. She said, "Girl, walk over to your desk, walk over to your computer, just sit down and make your appointment. No physical activity." She's just like, no physical that sitting down at your office desk chair qualifies you for taking the vaccine. Go get it. Go get it. And that's exactly what I did. I just went in and made an appointment. I mean, just the ridiculousness of it all, y'all. As you can tell,
Mm,
Lisa and I, in our non medical but educated, common sense thinking rationale, are simply telling you to seek out your medical professionals rather than this administration as to what you
yep.
and your family choose to do. We are not what is it, pro-vax or anti-vax. We're not saying any of that at all. We are saying we trust your chosen medical professional for your family more than we trust this administration.
I don't know. I'm pretty pro-vaccine, honestly. Like, I don't think
I'm
that's a.
personally in my house.
I
I'm
don't
in my
think pro,
house.
pro and anti-vaccine are like equal arguments. Like,
God, isn't that the truth? Absolutely.
get a vaccine.
Absolutely. I hear
Unless
you.
you have an allergy, get a
I hear you.
vaccine.
Mm-hmm.
Like it's
Mm-hmm.
like the not getting a vaccine is not better because yeah, well, that's a whole other podcast.
There you go. Look, y'all know how we do. We emerge out of one podcast and into another, y'all.
Hmm.
But anyway, all right, y'all. Well, thank you for being with us for yet another episode of Unfazed Unedited. You can certainly reach out to us on all of our social media and podcast apps at Unfazed Unedited. Email us info@unfazedpodcast.com or just visit our website, unfazedpodcast.com, to find all of the old and new shows. So if you like this week, please like, subscribe, leave a review, share with your friends, coworkers, or others in this phase of your life. So until next time.
All right, see you next week.